Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about community health resources. We spoke first with Joan Kaufman, CEO of St. Tammany Health System, who talked to us about a larger program outside the hospital. It's a community initiative called Healthier North Shore. Next, we're going to talk with Ann Pablovich, and Ann is going to tell us about the Be Well bus. So welcome to the show, Ann.
Thanks for having me.
And I love the name Be Well bus. It just bounces right off your tongue, and it sounds like a lot of fun.
It is a lot of fun.
But it's bigger than that, too. So tell me what the Be Well bus is.
So the Be Well bus is our mobile screening unit. We bring it out into the community. You know, the name of our game right now is early detection and prevention. And so we're trying to break down barriers by bringing these resources out into the community to make it as easy for people to access these services and screenings that we can offer, so that they can know the status of their health and take action early on.
I think it's interesting, we always say know your numbers, and if you don't have an established primary care provider and you're not going to see that primary care provider once a year in their office, you probably don't know your numbers. And it's really important for us to kind of get an idea of what our blood pressure is and maybe have a heart screening. And then from a cancer perspective, there are 5 major cancers that we want to be screening for and detecting early. Isn't that right?
Absolutely. So while we can do a vast array of cancer screenings on the bus, we're not limited to that. So there's a lot of capabilities there. We can do some carotid ultrasound, some AAA, which is an abdominal aorta ultrasound. We can do blood pressure screenings. We could do EKGs on the bus. The possibilities are really, really endless. But the cancer screenings, as you mentioned, we are fully equipped to do mobile mammography on the bus. So getting your mammograms are easier than ever, and it is a 3D mammogram. So the same technology that you would have at our women's pavilion is capable on the bus. Those images are fed to the fellowship-trained breast radiologists that are at our women's pavilion. So you're really getting, it's like an extension of the services there.
So you get the convenience of the mammography on the bus, wherever the bus is going to be at my convenience.
Absolutely.
But then the person who's reading it actually is at the Women's Pavilion, the Center of Excellence.
Absolutely. So you have that full level of expertise and top-of-the-line technology.
Wonderful. And then obviously the mammography machine is permanent in the bus, but you don't use it every time you take the bus out, because sometimes you're going to see an audience, say a gentleman's group.
Absolutely.
Maybe the Knights of Columbus as an example. They probably could care less that this bus has mammography.
They're impressed by it, but you know, they're not using that service. So other screenings that we can offer, we can do prostate cancer screenings, we can do skin cancer checks, head and neck cancer checks. We could even do cervical cancer screenings. And then there's assessments that we can do for lung cancer risk, which we would then refer to our outpatient pavilion to have a screening there called a low-dose CT, which detects cancer early on.
Okay, so it sounds like all of the major cancers, we have ways that we can go out into the community and do some initial screening, or at least have conversations that lead us to understand that we need to refer someone.
Yes, absolutely.
And the idea behind that bus is really being able to take those clinical personnel out into the field. And obviously you can't just drive up, park, and open the door and see who shows up. There's a lot of planning and logistics involved in that. And I know that's been your focus and what you're doing with the bus. Can you talk a little bit about the types of places you're going?
Absolutely. So we are on a rotating schedule. So we are at one of our clinic locations once a week. It's every Wednesday. You can check our website to see what that schedule looks like.
And that's
bewellbus.health. So mammography is the primary screening that's offered on Wednesdays, but we are able to offer other services on those days as well. Other areas that we're going to go to are employers for employee health fairs, which is a really great service because you're able to provide not only just those biometric screenings, which a lot of folks offer, which is phenomenal because you're engaging the patient and the employee on what their what their status is, but then we're able to expand upon that and offer things like mammography, make it as easy for these people to get these screenings done in a place that's convenient but still high quality. So we're combining different screenings, offering more services just to expand on those existing programs. Other places that we're going are community events, and so you'll see the bus out at some of our established community events, and we're also creating new events. So we're really trying to be out in the community everywhere we can be.
Well, fantastic. So I hear you saying that that bus is in predictable places, like in the parking lot of a primary care clinic on a rotating basis.
Yep.
So if a patient is seeing their primary care physician who's going through their annual physical and they say, I see you haven't had a mammogram, the bus is in the parking lot today, when you like to just knock that out and be done, and that's a very motivating factor to get their health care.
Absolutely.
And then similarly, to be in the parking lot of a major employer in town, that enables everyone who works there to take care of things like a cancer screening or carotid artery. Depending on what that population needs, you're going to bring that level of staffing with you on the bus.
Exactly.
And then I love this idea with the community events. So for example, once COVID allows us to keep having events again, maybe, for example, the White Linen Night that Covington does, if the bus is parked there and it's a hot night, and white linen or not white linen, you're still hot, you can get overheated. And to be able to visit the bus and hear a little bit about how to cool yourself off and take care of yourself and be aware of signs and symptoms of heat stroke.
Absolutely.
That's an education opportunity for the bus in the community.
And that's another important part, because everywhere that we're going to go, we plan to do educational outreach so that we're maximizing our impact and really spreading the word, for a variety of reasons.
Great.
Vaccinations are another thing that we've done recently, trying to help with this most recent wave of COVID. We've seen a lot of businesses say, can you come and offer vaccines for our employees? And so we'll staff up and go out and welcome anybody that wants to take the opportunity to get the vaccine if they haven't yet. And that's been very helpful, I think, to a lot of employers. You'll see us out and about. You see our Facebook posts where we're offering those, and we're going to continue to do that.
Fantastic. And I think, to your point, being able to take the Be Well bus to an event or to an employer or other public place, in a lot of cases we have people in our community who haven't bothered to get the vaccine yet. It's going to take an appointment. It sounds like it's going to be too much trouble. They may have to take time off of work to get it done. If they can just get on the bus and get their shot, that's an easy way to do their part to keep our community safe, to reduce risk for themselves and their family. And the vaccine is there and convenient on the Be Well bus.
Yep, no appointment required. And that is, we've seen that time and time again. People just don't want to take the effort to call, make an appointment, take off of work, just as you said. So if we're, if we've got it in there, the course of their natural day, and it's an easy decision for them to make, then that's one more person that we're able to help and help protect our community.
And every vaccine adds to that herd immunity and makes us all safer as a community.
Absolutely.
Well, that is beautiful, and I'm so grateful to you for being here to talk about the Be Well bus.
Thank
and I
you
look
for
forward to
having me.
seeing the beautiful Be Well bus around town.
It'll be out.
Thank you.
Thank you.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about community resources. Up next is Aaron Strain, who'll teach us about corporate health solutions. We'll be right back.